Okay, next session it is going to be quite interesting, I believe. Challenges to public safety in our cities. And the moderator was supposed to be Marissa Lagos from KQED, but it turns out she is unable to be with us today. So our very nimble and versatile Jalou is going to step in to be the moderator. I've already introduced Jalou, but I'll just say again, she's spectacular, great organizer for today. So who better to fill in than Jalou Streeter? So take it away, Jalou.
Okay, as you can see, I'm not Marissa. And I had to prepare for the moderation, this moderating session starting this morning, so I only had a few hours to prepare. You have to bear with me. So we have a great panel. Jeff Kosicki, where is it? Jeff? He has worked in social services for over 25 years, focusing on homelessness, affordable housing, and economic development. He served in leadership positions at nonprofit organizations in the United States and Latin America. In 2016, Jeff was appointed to serve as the founding director of the San Francisco Department of Homelessness and Supportive Housing. During its first 4 years, the department helped end homelessness for over 7,000 households and prevented homelessness for approximately 5,000 adults and families. In March of 2020, Mayor London Breed appointed Jeff to run the Healthy Streets Operations Center, HSOC, an initiative to better serve unsheltered people in San Francisco. HSOC reduced encampment by over 85%, placing nearly 2,500 people into shelter programs. Jeff currently serves as is part of the Urban Alchemy, leading the organization's national expansion efforts. Next up is Thomas Wolfe, who I already introduced earlier. He is a real character, one of the real characters in Michael Schellenberger's book, if you had read the book. He is now an advocate for addiction recovery. In 2018, Tom spent 6 months homeless on the streets of the Tenderloin neighborhood, struggling with heroin and fentanyl addiction. He was arrested 6 times and eventually went to jail for 3 months before going to a 6-month inpatient treatment program where he found recovery. Tom has become a strong voice for a new approach to the homeless and drug crisis in San Francisco. His story and solutions have been featured in local, national, and international news, including CNN, Fox News, New York Times, LA Times, and the San Francisco Chronicle. Tom is a co-founder of the California Peace Coalition and is the founder of the Recovery Education Coalition. Next up is Vern Pearson. Vern is the district attorney in the El Dorado County. Where's Vern? Right here. He created a highly successful cold homicide task force. He was the former president of California District Attorneys Association. Vern was instrumental in the passage of several pieces of legislation, including drafting AB 141, which expands the use of propensity evidence in child abuse and domestic violence cases. During his career, Vern has personally prosecuted approximately 100 cases through jury trial and has been assigned as a vertical prosecutor for domestic violence and sexual assault. Vern went to serve in the U.S. Army after high school. His experience in the military and his strong work ethic were instrumental in his successfully earning his way through college and then law school. Last but not least, Laurent Armstrong is the chief of the Oakland Police Department. Under Chief Armstrong's leadership, the Oakland Police Department developed a new Stop Data Collection project, which has been recognized nationally for its implementation of strategies. The project has reduced the number of police traffic stops by 60% since 2016 and stops of African Americans by over 65%. He served as the department's liaison to Stanford University's Spark program. He born and raised in West Oakland. Chief Armstrong has been the subject of multiple news articles regarding Black officers policing in America, and he is one of the featured officers in the award-winning documentary The Force. He was the former president of the Oakland Black Officers Association. So I will, as usual, I will invite each one of our panelists to come up here and give their short summary of what they think the main problems are. So Chief Armstrong is sort of delayed, and then he's on his way here. So he will join us when he gets here, okay? So the first up is Jeff.
Thank you all for sticking around for what's been a long but really interesting day. It's a little bit unusual, I guess, to talk about public safety at a conference around homelessness, but there's certainly interaction between the two issues. Because it's such a complicated topic, I think my slides maybe don't make a ton of sense, or they may feel a little bit disconnected from one another, but I'll do my best, so bear with me. I feel compelled, as somebody who's worked on this issue for actually 30 years now, to say before I start talking about public safety that homelessness is a housing problem. There's tons of data around it. I'm not going to get into that because that's not what I'm supposed to talk about, but it's called homelessness. So the solution to homelessness is to provide somebody a home. And to conflate it with public safety and substance use and mental health issues is frankly wrong and part of the problem that I think we're facing. And Housing First is not perfect, and it does not work for everybody, but that does not mean it does not work. And I think it's important to just acknowledge this as somebody who's worked in this field but has been asked to talk about a slightly different topic. However, I also want to acknowledge that there's issues adjacent to homelessness that are really, really problematic and are causing serious deteriorations, especially in our urban communities. Mental health, substance use, and other public safety issues have been talked about a little bit, but to acknowledge that those don't exist and that homelessness has nothing to do with mental health or substance abuse is just as wrong as saying it has nothing to do with housing. It's all of the above. And I was told not to show up here without having data with my slides. So there's a little data there. It shows that homelessness gets worse when housing is more expensive. And this shows that the more homeless people we had in San Francisco, the more people felt that the more complaints there were. And there's a ton of data, 911 data, crime data, all kinds of data that show increases in complaints and actual problems being caused as the number of homeless people increase in a community. And we can't ignore that, especially, I've worked most of my career in the nonprofit sector, but when you work for the government, everybody is your constituent. You have to respond to everybody's needs. The person whose door is being blocked and they can't open up their business, we need to think about him as well as the person who's sleeping in front of that person's door. You just can't ignore these problems. But you also can't conflate them. They're different issues, they have different solutions, but the good news is there are solutions. There's solutions to our housing problems. Roseanne Haggerty talked about some great work that's being done all over the country, and there's solutions to how do you address kind of the nexus of homelessness and other issues. And you'll see the numbers start to go down, the number of complaints that we got in San Francisco, and you'll see that tracks with some of the solutions that you'll see here. In 2017 in San Francisco, we had about 1,100 tents in the city, and you'll see that number dropped. It went up again dramatically during the pandemic and then went back down dramatically. And that's because the initial success was due to something called HSOC that I helped form and then ended up running, which was a multidisciplinary team of mental health clinicians, peer workers, outreach workers who had been homeless themselves, San Francisco Police Department, as well as our public health department and our parking and traffic, like everybody, public works. And we would go out to encampments and we would use a services first approach, but a multidisciplinary team. We didn't tell people to leave without offering them treatment, without offering them a shelter bed and a place to go. But we also but you can't stay here. We're gonna offer you all these things, but this neighborhood has gotten out of control. We can't have 60 tents on 2 blocks in the Tenderloin. It's not fair to the people who live in that neighborhood. This is not cool, but we also know you need help or you wouldn't be out here. So let's do that. And it's proven extremely successful. It's been replicated in many cities now around the country, most recently in Austin, Texas. Another thing that we should be thinking about, because there's a lot of discussion that I think is really important around finding alternatives to policing. I think the police play an incredibly important role in all of this, but I think there's times when, and I've worked with many police officers, and they're some of the best outreach workers I've ever met, but I think sometimes they're not the appropriate response. So the organization that I work for, Urban Alchemy, provides alternatives to policing. Essentially, we are trying to encourage people to engage in pro-social behavior, like to not block the door or to use the restroom around the corner as opposed to using the sidewalk. And all of our staff, or 96% of our staff, have been incarcerated. 80% of them were LTOs, or long-term offenders, meaning they're on parole from a life sentence. And they do absolutely magical work in really just creating dialogue in a community and letting people know, like, hey, you know, we all got to live here together. And that way a cop doesn't have to come out to ask somebody to move from a doorway. You can have a community member do that work. And this is proven, we didn't invent it. This movement has been around since the 90s. Some of you may have heard the name Akila Shariels, who helped negotiate the truce between the Crips and the Bloods in LA. He was one of the early proponents of this and is now kind of building a national movement as an alternative to police. However, a lot of this stuff doesn't work, not because it doesn't work, but because of like politics, really, and because of silly infighting and statements like homelessness is only a substance abuse problem or housing first doesn't work, and these extreme views that are thrown around really distract us from just following like proven, just all these proven interventions. And we got to be able to walk and chew gum at the same time. We have to be able to solve our housing crisis and deal with chaos on our streets at the same time. And frankly, we can. There's tons of evidence. We need more housing. Okay, I agree. I've been spending most of my career trying to get more housing. I've helped build thousands of units of permanent supportive housing. But we can fight for that at the same time that we can fight for better mental health, addressing substance, unfettered like drug dealing in our streets. We can set expectations on what's an okay behavior, and we can promote these solutions at the same time. But the problem is we turn it into these fights where everybody's on like one, well, not everybody, most of us are probably right in the middle and can hear both sides, but it's these loud voices on either side that say, if you try to tell somebody to move out of that doorway, you're a damn fascist. And you should be fired from your job. That's what they said about me. Even though I've probably built more housing, and I like trying to toot my own horn, but I probably have developed more housing for homeless people and shelter beds in San Francisco than anybody else in the city. I've been doing this crap for a long time there. But nonetheless, I'm a fascist because I think the guy who runs the Vietnamese restaurant in San Francisco and can't get into his restaurant has a right to get into his restaurant and start his day doing his business. That doesn't help. And also saying housing first doesn't work. I'm sorry, Michael Schellenberger, I do like Michael quite a bit, but to say housing first doesn't work is also bull. I mean, I'm sorry, but like making statements like that is not helpful. And it also doesn't understand housing first. Housing first is everything from a bus ticket back home, which is a great way for somebody to end their homelessness for $500 if there's a family member willing to take them in, to really expensive permanent supportive housing. It's not just permanent supportive housing. I agree, hard to scale permanent supportive housing as a singular solution to homelessness. There's a lot of stuff that needs to happen, but please don't say it doesn't work, and please don't call me a fascist. I mean, none of that helps any of us, and it certainly does not help homeless people. So I guess the one thing I'd like to leave you with is there are data-driven best practices. Roseanne talked about them. There's tons of them. I showed you a little bit of data about them. We just have to stop fighting with each other, and we have to listen to each other. And I shouldn't be so snarky about Michael. Because at the end of the day, I listened to Michael, a lot of what he said is totally true. We have to hear each other and we have to compromise. I can't get everything I want. Michael can't get everything he wants. So we have to find a common ground to solve both of these problems, not just one of the problems. But I also will tell you constant like BS that, again, I feel like I'm being like poor me because I'm housed, man. I don't have like too many problems in my life, and I'm a white man too, so I got even fewer problems. But the bottom line is, I just took so much crap trying to find a middle ground for this stuff that I just could not stay in my job and maintain my own mental health. And I love Mayor Breed, and I feel bad that I just left, but my wife would have, I just had to go. It was just too much because just the constant abuse, and all of my colleagues who have run big homeless departments in the United States, none of them have lasted more than 5 years. Most don't last 3 years. So, and it's because of all this. Like, we know what to do. The police chief, who's not here yet, he knows what to do. I know what to do. Many of you in the room know what to do. Tom Wolfe knows what to do. But we have to stop, like, just being assholes to each other, pardon my French. So that's it. I think I went over my 5 minutes. Thank you.
So I'm a lawyer, and so I'm not an asshole. It's an honor to be here, despite that fact. And about 20 years of I've been a prosecutor for more than 30 years. About 20 years into it, I had the great idea to go back to graduate school. I went to the Naval Postgraduate School in Monterey. And one of the most significant, I didn't learn a lot of things. No, I did. One of the most significant things that I learned there was they talked about this concept of a wicked problem. A wicked problem is most of you know what this is. It's a complex problem that doesn't have an easy solution. If someone walks up to you at a function and they say, well, the way you solve homelessness is by this. With certainty, they know virtually nothing about the problem that they're offering a solution to. And it is really a privilege with J-Lou and the rest of the people here that when the first time I spoke with her, she said, we want to talk about it from all the different perspectives. We want to talk about it from a data standpoint. And unfortunately, this is here in the state of California, and you asked the question of why is it getting worse here in California? It's like, unfortunately, in being involved with, working with the legislature on a number of different things over many years, the way this has gone today is not the way Sacramento addresses public policy problems. And I'll talk a little bit about that and the mistakes that we have made where somebody had a really good idea, it was a very well-intentioned idea, and it was poorly implemented, it was not well thought out, and we are all suffering the consequences. And we've done this multiple times. We'll go back to the early 1960s when President Kennedy signed an act which was supposed to create community treatment centers for the mentally ill. It was a great, well-intentioned idea. I think he probably was pursuing that idea out of the knowledge that, how bad mental health facilities had become at that time, and that people, a family member of his, was locked up in a facility and never should have been in that facility in the first place. Fast forward to here in California when President Reagan, became President Reagan, then Governor Reagan, have you ever heard the expression, Reagan closed the mental hospitals? I've heard that for many years. And it's true. He did close the mental hospitals because that was the directive that was happening. Here in the United States and here in California, we pretend like we do things and it's novel. Someone else hasn't already done it. The deinstitutionalization movement was an international movement that really started more so in Europe and then spread to the United States. What happened here was well-intentioned, but failed execution and failed thought out. Here, we were supposed to build community treatment facilities that would actually take care of people that were coming out of the mental hospitals, to use that term from back then. Europe, they did that. Here, we didn't. We spent the money on other things and we failed to build them. So what you had, you mentioned it earlier, you have a slide, and it's in the program, J-Lou had the chart where it shows the number of beds going down like this. But then if you look at that, at the same time, you have jail and prison incarceration going up proportionate to how much was going down. In other words, we let people out of mental hospitals, and then those same people became, and I'm going to use the term low-level offenders. What I learned 30 years ago was the expression was people doing life on the installment plan, in terms of people who had some type of substance abuse issue, mental health issues, combined together very often, and they would commit low-level felonies throughout their life, come in and out of custody. And what happens when you go into custody, if you've been living on the streets and you're having problems? You sleep normal hours, you eat normal food. For the most part, you don't have access to alcohol and drugs, and suddenly you seem a lot better. And they feel a lot better. They don't want to continue taking their medications. The doctor referred to that analgesia, if I'm not pronouncing it right, the phenomena where someone is in that type of environment and they're better. So like I said, we closed the mental facilities and we had our jails become the de facto mental facilities, which was not the right way to deal with it, but it was better than people living on the streets. And let's put it that way. All right, but then fast forward, that was deinstitutionalization number one. Deinstitutionalization 2.0, if you will. Jerry Brown is governor. He has a real problem because of all of this stuff. We have a population, an in-custody population with the California Department of Corrections, went from, when this movement started, 25,000 people in custody, up to 170,000 people about 8 to 10 years ago. In custody in CDCR, and many thousands more in jails throughout every county. It was costing too much money, so Jerry Brown said, we're going to do what's called realignment. Realignment was sending these low-level offenders back to the counties and having them housed at the counties. While they're housed at the counties, what ends up happening is, because of the population that's there, we're letting more and more people out. Then Prop 47 happens 3 years later. Prop 47 took these classes of, and I'm calling them low-level felonies. These are not rapists, not murderers, not the most aggravated types of cases, but they are people, as I said, coming in and out, doing life on the installment plan, and suddenly those felonies became misdemeanors. And in California, unlike Texas and other places, misdemeanors are little or no consequence. So what ended up happening is that these people in 2.0 over the last 10 years, they're not living in jail, or they're not coming in back and forth in jail, and seemingly getting better during that period of time. Instead, they're decompensating more and more. They get worse and worse, and then they commit much more aggravated, much more serious crimes, or they just live and they're living homelessness on our streets. That is one part of the problem, and I appreciate it. And I'm not talking about, this morning they talked about the housing. Anybody who tries to tell you that this problem has nothing to do with the cost of housing I don't know what the strongest enough expression. Of course, the cost of housing, the NIMBYism, all of this stuff, it's a major component of it. But a major component, and the reason why we have approximately 50% of the people who are living homelessness right now have some level of significant mental illness and or combined with drug addiction, is also a significant part of the problem. And I'll leave it with that for now.
Hi there, good afternoon. My name is Tom Wolf, and I'll just say to my friend Jeff over there, I'm definitely in the middle on this, okay? It's true, yes, I am a formerly homeless recovering addict. That's what I call myself. 4 years ago this very day, I was homeless on the streets of the Tenderloin, sleeping in a doorway on Golden Gate between Hyde and Larkin, severely addicted to heroin and fentanyl and crack and benzos and alcohol and whatever else I could get my hands on, because that's what those of us that were out there using, we are all polysubstance users. It's not just heroin, it's everything. I'm here today to get really specific, to talk about the role of policing in our cities as it pertains to homelessness. So I'm just gonna leave it there, because I pretty much agree with a lot of what Jeff says about housing. I think we all kind of do. We know that California is in a big crisis right now. around housing and how we're going to solve it, but I want to stay specific about policing. So there's a whole movement in this country, and it's still out there, to defund the police and to remove the police from responses regarding people that are living unhoused on the street, especially people that are sleeping rough directly on the street. There are two things I want to point out about that. So I was arrested 6 times in a 3-month period between April 29, 2018 and June 23, 2018 in San Francisco. First time I got arrested, I was holding 4.5 ounces of heroin as a mule for the drug dealers that are out on the street, okay? I thought I was gonna go to prison. I got booked, I went to county jail, I spent 16 hours in jail, and I was released on my own recognizance back into homelessness. I wanna stress that, okay? So it's not like they sent me to San Quentin, like they paint the picture on TV and all that. No, I was released on my own recognizance, no bail, 16 hours flat. And what did I do? I went right back to my drugs on the street. Okay. Then I got caught in that cycle because I kept doing it over and over and over, violating my stay-away order, shoplifting, holding more drugs. And I kept getting caught and kept getting arrested, kept getting booked. And then pretty soon after the 3rd, 4th time, I started realizing it's the same cop that's arresting me all those times. I'll never forget Rob Gilson, Officer Rob Gilson. He's not a cop anymore. He quit SFPD because things were not, it was hard. And I'm really sad about that because he was a good cop. I have to say it, just honestly. He was a good cop. He cared enough about me. He gave an F enough about a homeless guy that all of you, with all due respect, would have stepped over and walked right by. He cared enough about me, okay? So when we talk about defunding the police, I have to go with our president on this, man. It's like, no, we need to have smart policing, but we need to fund our police to have them out there because they do play a critical role in addressing the street crisis that's on the street, period. I'm here today because of that cop's intervention. And so I'm gonna show you a short video because now in my recovery, I'm a I'm a recovery advocate. I advocate for sensible drug policy, drug policies directly related to homeless policy. I think we need to acknowledge that and recognize that and pay close attention to that because drug policy in this country right now is going off the cliff, and that's super dangerous. I think we also need to acknowledge the drug crisis that's out there on the street. I think to do so would be irresponsible, to be quite frank. Last year in the Tenderloin in San Francisco, SFPD pulled 26.6 kilos of illicit fentanyl off the street just in that one neighborhood. And that's also where all the homeless people hang out. You do the math. It's hard. It's like, I could cite data all day long. 650 overdose deaths last year. 40% of them were actually unsheltered on the street that died, right? But the bottom line is that all you have to do is walk down the street and you know that the issue of addiction and drug use has severely complicated the issue of housing the homeless in this state. And it must be addressed in a sensible manner. And that means that police must be involved whether we like it or not. And here's the other reason why. Let me see if I can make this work here. So, I don't want to lose all your attention. Stay tuned, promise. I promise this will be worth it. That right there.
So when you say you know how to be homeless, what exactly do you mean?
I know in Los Angeles, I've been homeless in San Francisco. I know, first of all, I know where to go. I know where you're not going to get trouble. I know where you're allowed to be homeless. Second of all, I know how to make money. I know how to make more money than I do now with a professional job. I can make $400 to $500 a day being homeless, and that is through theft. It's a very precise system of you find people, there's fences, there's people that buy stolen goods and they tell you what they want and you go into stores and you take those goods and it can be very lucrative if you're good at it. I know how to be a criminal. I mean, really, I mean, that's just, and I learned that. I didn't, I wasn't homeless the first day and knew what I was doing, but I ran with other people and people took me under their wing and I learned how to do that. And I know how to sacrifice my dignity and just kind of, I can sleep outside. I know the public restrooms that I can go in and do drugs in and take bird baths. And I just, it's a whole system. When you have to get good at it, you get good at it.
Okay, thank you. You go for it. So I just wanted to share that with you and then put it in context for you, okay? I'm not out here to bash the homeless. I was homeless too, okay? But you have to understand the context. This guy was homeless for 10 years on Skid Row, in San Francisco, in Miami, and in New York. And all that time, the way that he survived and supported his addiction was through these means, right? So we now, as a community, as a society, have to make a decision. Are we going to allow that in the interim while we wait for housing to be scaled up and get this guy off the street or get him into treatment? Or are we going to ask police to intervene in his situation? Now, he's in recovery right now. He got sober almost the same time I did. He's almost 4 years clean and sober like me. The last time I used was June 24th, 2018, and I think his was in August of 2018. And we both got clean because we were held accountable. And you can ask anybody that's in recovery, and I'm sure there's some people in this room that are in recovery like me, and you can ask them, what's one of the most important cornerstones for your recovery? And they will all tell you the same thing: accountability. So it's really important that we figure out a way for policing, smart policing, to work to mitigate this situation while all of you that are making the policy are figuring out how we can get these people off the street permanently. Thank you very much.
Thank you all so much. That was great. So I guess I would start the conversation by asking some simple questions, just like a number, a percentage. I'll ask Jeff and Tom, since you are very familiar with the Tenderloin area. So what percentage of people in tents? Okay, I'm not talking about people who are displaced or become homeless because of economic reasons, but what percentage of people who sleep in tents in San Francisco are not from the city? Jeff?
Okay. Well, first I want to say, like, in the ideal world, that shouldn't matter, because whatever zip code you're from shouldn't make a difference as to whether or not you receive assistance. I also want to say people aren't coming to San Francisco because they love our shelter system or for our services. If they are coming to San Francisco, I think Tom would probably agree, they're coming because it's an easy place to buy and use drugs. Yep. People they have addiction issues. I mean, there's people who also come like I did, just because I wanted to live in San Francisco and didn't want to live in Philadelphia anymore. And I think people come out and things don't go well, but I think a lot of people do come to the city because of the easy access to very cheap drugs with very little consequences for selling, buying, or using. So I felt like I needed to say that before I just threw out a number, because in my heart I don't think it matters. But I will say that it's probably well over 50% of the people who are living in tents in San Francisco are not from San Francisco. So our point in time count data, homeless surveys that we do every other year, says that it's 30% of the population comes from somewhere else. That's self-reported data, and I don't believe it, not for a second. And a lot of communities say this, but I think in San Francisco it's particularly true. I'd say at least half of our overall homeless population comes from somewhere else. And there's there's some little data that we ran, like we went and looked, we ran compared our shelter roster against open Medi-Cal cases in the state, and found that I think it was over half of the people had open Medi-Cal that we had open Medi-Cal cases, had them in other states. And anybody want to guess which county had the most people from somewhere else? Which county it would be?
LA?
Yes.
LA?
Los Angeles. Tom knew because he knows. Yeah, LA. Alameda was second. So sorry, that was a long answer to your question, but it's kind of that's a loaded question that brings up a lot of emotions. But I would say we don't know for sure, but I would say it's well over half. Most of my colleagues on the San Francisco Police Department will tell you it's about 70%. I think that's a little high, so I kind of go in the middle and say 50.
What do you think?
Yeah, I mean, so look, I agree with Jeff that we shouldn't have to ask that question. If we had regional parity amongst all the 9 Bay Area counties and then extended across all 58 counties with services, we wouldn't have to ask this question. You know, Yolo County has 0 treatment beds, okay? 0. San Francisco has, you know, maybe 1,000 when you factor in all the abstinence-based, faith-based programs and all that. Maybe it's 1,000 beds. So that means if someone's seeking out help and is in their addiction, they're motivated to come to San Francisco because of the 24/7 access to fentanyl and drugs on the street. San Francisco does have an organized cartel-fueled drug dealing happening. It's highly organized, okay? And it's entrenched in our city. It's unquestionable that that's what's happening. And at the same time, even if they wanted help, they couldn't get any help in Yolo County. So they got to come to where they can get help, and that help is San Francisco. So if we had regional parity, we wouldn't have to answer that question. But yeah, look, the people that live in Bayview Hunters Point that are homeless, they're from here. They're from San Francisco. But the people that live in the Tenderloin, I think they're more transient. They're probably like 80% not. So when you put them all together, it's probably 55% that aren't from there.
So you can see Chief Armstrong just got here. Thank you so much for coming all the way here for us.
Oh, no problem. Thank you.
So next up, I would want to ask something about shelter spaces. So we know in San Francisco, there is a huge shortage of shelter spaces. But at the same time, sometimes when the shelter space is available, unsheltered homeless persons, not all, but some, may turn it down. So why would that happen? I guess that's a Jeff question.
Well, you're asking all the really hard questions, which I appreciate, because this is another loaded issue, this idea of service resistance that comes up a lot. And I would say there's absolutely some people who don't want to go into our shelter systems, but they don't want to for very good reasons. I would say I have fortunately, thank goodness, have never had to experience homelessness, but I would never go into a shelter if I were. I can't tolerate being around that many people in an enclosed space. It would just freak me out. I'd rather sleep in the rain, frankly. And I think a lot of people, that's the case. I think for other people, they're not allowed to bring their partners with them. You know, and who's going to leave their girlfriend or boyfriend or you know, partner out on the street because they get a shelter bed and you don't, or you can't be together. And people also, like, there's no privacy. I mean, you have to remember, like, sometimes we think of homeless people like they're things. I mean, it's you know, really sad, but they're a statistic. They're human beings. They want to do all the things we want to do. They want to have sex. They want to maybe have a cocktail. They want to maybe read a book in private. And if you don't offer them that, and a tent's a better option, then they're going to go to a tent. So part of it is we're just not offering a full range of services. And San Francisco's gotten way better at that. So we now have sanctioned tent encampments, in addition to congregate shelters, and now we have hotel-based shelters, and we have tiny home villages. I think that's kind of the right way to do it. So when I was leading the outreach team, yeah, some people would say no, but when we went out with if I said, oh, all I have is MSC South, which is our worst shelter in the city, people would be like, no. I'm like, don't blame you. Let's, you know, move on. I ain't gonna like punish you or penalize you or make you move because you don't want to go to a place that I won't want to go to. But when we go out with a menu, which is what we normally did, we'd of course start with who's going to take MSC South first, because that's what we would offer. And then, well, oh, you don't want to go there? Well, how about one of our navigation centers? I can't go to that neighborhood because of gang affiliations. Well, let me see if I can get you into another one. Like you have to like understand that like these are human beings with agency, and most of them have common sense. Even people who are mentally ill, and even people who are using drugs, like doesn't mean they don't have common sense and they can't think about what they want. So yeah, there's some people who don't want to go inside, but I wouldn't call them service resistant. I would say the system isn't serving them. And there's things that we're doing in San Francisco, at least in a lot of other places, to deal with that. That doesn't mean I think it's okay for somebody to set up a tent wherever they want. because it is against the law. And I agree with Michael that we should be enforcing laws, but I think we got to kind of find some balance, and not just say, well, I'm going to offer you a crappy shelter bed for 2 nights, and then you need to do this. We got to find some kind of balance between the need to keep our sidewalks safe and clean and to not have crazy encampments with 70 people in a neighborhood creating all kinds of chaos, mostly amongst themselves, with having a system that makes sense and is humane and treats people like humans.
Speaking of enforcing the law, so just now Vern said something about Proposition 47, right? So I just have some questions about that, and perhaps Chief Armstrong can also address that as well. So suppose now I went to Safeway right now and steal something, say $900. What would happen to me? Or say I held heroin or I don't know, meth or some other hard drugs. I don't even know the names. Like, what would happen to me right now?
Well, I hope you wouldn't do that. I think Prop 47 has really changed the way we police our city. The idea that for an auto burglary, for instance, where someone obviously busts somebody's car window and remove their belongings, these are in Oakland, what we consider to be misdemeanor cases, or even what we consider the thefts that you mentioned, going into Walgreens and stealing $900 worth of items would also be a misdemeanor, cited into misdemeanor court. And then due to the COVID pandemic, our misdemeanor courts are actually not even hearing cases. So essentially there's 0 consequences as a result of that theft. And that's challenging for business owners. As you see in Oakland, it has forced companies like Walgreens to have to actually hire police officers to provide security. A huge expense for any corporation, very difficult to keep businesses in a city like Oakland when you have crimes that they know won't be charged. And so it is really challenging for us when we think about the idea that someone in possession of heroin or being under the influence of narcotics, not that it should ever have been something that we arrested people for, but now we are sending them to diversion court. And in diversion court, the question is what is the consequence for not actually continuing to go through the program, continue to complete the requirements of the court? And so we tend to see, obviously, people have multiple interactions with us and be engaged in multiple things. Question is someone who obviously have a substance abuse addiction. The question is if they don't agree to go into treatment, how do they continue to feed that addiction? And in most cases, they tend to be involved in a lot of low-level crime in Oakland. And so some would say in Oakland, but not much different in San Francisco, at least a year ago, it's hard for you to park your car in Jack London Square and not expect for it to come out with a new window. And so that is the challenge of how do we manage this with these laws that don't allow us to take very much enforcement action. How do we demonstrate to the public that we're actually trying to protect you and protect your property when we really can't do anything when these things happen? I was, working with our encampment management team is what we have in Oakland that manages all of our encampments. And we have an individual that's unsheltered who has over 400 bicycles. 400 bicycles taking up a complete lane of traffic. And we are trying to wrap our heads around. We continue to try to provide service and support that he's refusing. But then the question is where does all these bikes come from? And how do we get them back to their rightful owners as well, right? I mean, there is a lot of bikes missing in Oakland. And while we laugh, these are the things that our community members oftentimes complain about, right? The idea that I can't walk in my house and leave my bike on the side of the house because it'll be gone immediately, and the police department is not going to do anything to help me retrieve that bike. People lose confidence in law enforcement because we're unable to enforce laws. So then people become cynical and go, why even call? And then we see 400 bikes, right? Because now 400 people haven't actually called police or reported those crimes. And so I think it is sort of that trickle effect that continues to have a huge impact on overall crime and safety in communities where people begin to lose confidence in our structure, our ability to respond and keep them safe. And so I think that's the challenge that we see in Oakland.
I guess I have a question for Vern related to Prop 47. So we know that in California, the threshold is $950, right? If you're still under that, you're, as Chief Armstrong just said, very little will happen to me. But in Texas, the threshold is actually much higher. I think it's about like 2,400 or so. But why we don't see the same problem in Texas?
Well, it's a very good question. The practical reality is culture in terms of the way we do law enforcement here, the way our jails are and prisons are overcrowded, and the reaction of how we deal with them. So I spoke at a conference a few years ago in Texas, a law enforcement conference, and they refer to people who commit crimes in Texas as criminals. That's openly. They're referred to as criminals. In California, they're not referred to as criminals. They're referred to as justice-involved individuals. And so there's very different cultural differences. And so when we talk about Prop 47, we say, well, if it's a misdemeanor, that basically means nothing. And the chief did an excellent job of describing that whole interrelationship of what happened. So when you commit a misdemeanor, that type, we'll call them a misdemeanor, $950 today, you can do it over and over and over again. And even if you are prosecuted, the governor, just shows you, it's not, that Prop 47 was very deceptive in the way that it was written, and it's very complicated. In California laws, I hate lawyers as much as anybody. The way it was written, the governor of the state of California, who's a smart guy, did an interview, and he was mad. I was the president of CDAA at the time, and this was about a little over a year ago, and he was mad at me about something I had said about, it's called petty theft with a prior. It used to be in California, if you committed theft multiple times, it would be, regardless of our ability to prove, because it's not just that it had to be more than $950, we have to prove that it was $950 and that you were the one that did it. So the smash and grabs that take place, 5 people go in, 3 of them get arrested outside, they all have $945 worth of property on them. One of them has $8,000 worth of property. That one's going to get charged with a felony. The other ones are going to get charged with misdemeanors, if at all. That's the reality of what the law is. The governor was questioned about it by an editorial board, and he said, you can do petty theft with a prior. Those damn Republican DAs are not telling the truth about it. And it's like, it looks like that's what the law looks like it says, but there have been 3 or 4 prosecutions since Prop 47 passed for petty theft with a prior because it's so complicated without going into why. What ends up happening here in the state of California, if it's a misdemeanor, it typically does not even get reported. So understand it this way. If you look at it, Marissa, who's supposed to be the moderator, the first time I talked to her about it, she said, how is it that in San Francisco, car burglaries and car thefts are going up significantly, but every other type of property crime is going down? And I said, well, it's actually very simple. This is one of the simple ones. Insurance companies require, if you get your car broken into, if you make a claim, you have to make a report. If your car gets stolen, you have to make a report. Typically what happens is it's just a phone report, or you go online and do the report, but there is a report, so it's recorded, and there's a record, and the data is collected on that. On most property crimes here in the state of California, and in particular in San Francisco, there is not going to be a record of it because it's either never going to be reported by the person who's the victim of the crime or the way law enforcement handles it. There will not be a record, so it gives this deceptive thing that it seems like property crimes have not gone up as much as they have.
Thank you. I have a question for Tom. So probably it's like a 2-layer question. Since you were on the street using drugs, and now later you became a case manager at a permanent supportive housing. Mm-hmm. So you've seen both sides. So the first question is, when you were on the street using drugs, did anyone come up to you and say, hey, Tom, do you want to go to rehab? And the second question is, when you were a case manager in the permanent supportive housing, which is supposed to provide the wraparound services, did you provide those services to your clients?
Okay. Well, so the The answer to the first question is yes, the police. The only time I was ever approached on the street for anything other than did I want to buy dope or did I want to buy some stolen goods, just being honest, was the cops. And it was usually because I was doing something wrong, okay? I didn't have anybody come up to me doing outreach, and you know, maybe that's changing with Urban Alchemy out there. There's more people out there walking the streets, street ambassadors. I think that's good. But I don't think that you can discount the importance of the outreach that police do on the street. We were both just talking to a guy that's a cop in Richmond, California here, that was here at this conference that left early, and he does street outreach. They've been doing it for years. I think that that goes unnoticed, or it doesn't get talked about in the whole role of policing enough. We talk about just the guns and this whole thing and, you know, all of that stuff. Okay, you know, it's not 1987, okay? The war on drugs is over, okay? I'm just telling you now, in San Francisco, the war on drugs is over. They arrest 40 drug dealers every single month in the Tenderloin, and they don't arrest anybody for drug possession. And it's been that way for years. When I was on the street, and I remember one day I was hitting a crack pipe standing on Hyde Street in Sacramento, in San Francisco, and I take a big drag off my crack pipe, and I turn around, and a cop had ridden up right behind me on a bicycle. And he was just looking at me, and I'm looking at him, and I freaked out, and I panicked, and I exhaled the crack smoke right in his face. Right? You know what happened to me? He told me to step on my pipe and walk away. Okay, that was 4 years ago. So there's no drug war in San Francisco. What's going on now is not the drug war, and it's something else that's completely twisted, where we've allowed it to be a free-for-all. Now, and I explained that with the statistics of the amount of drugs we're pulling off the street in San Francisco, and that's just a small, tiny fraction of what's actually out there. Now, as far as offering services and as a case manager, I tried. I mean, we all tried. If you're working in case management or social work, you're not there for the money, okay? You're there because you actually care. You want to, like in my case, I wanted to give back in recovery. I wanted to give back to the people that are hardest to serve. I was working 2 blocks away from where I used to sleep on the street. That was hard, walking through the TL every day, from BART up to my job, walking past where I used to sleep, seeing the same drug dealers on the street, seeing some of my friends out there. You know, this was just a year and a half after I had gotten off the street, not even that, like 15 months later. And we tried, but you know, there were 3 case managers to serve 103 people inside. So you know, they talk about housing first, and I'm not bagging on housing first, okay? But they always cite Finland as an example of how housing first works great. Well, did you know that in Finland, they average 7 staff per every 21 residents in their buildings? 7 for every 21 residents. There were 3 case managers, and we were getting paid under $25 an hour, okay, to serve 103 people that had a variety of issues, from addiction to severe mental illness to hoarding to they were aged out foster youth. They didn't know anything concept about cleaning their room, let alone making a resume and getting a job. Okay, that has to change if we want housing first to work as it's intended. That's where we need to invest our money. We need to pay these workers. We need to give them adequate training, staff them, and then give them a real incentive to stay so they can really create a recovery-oriented type of system of care inside this permanent supportive housing. That's how you bring people back.
Thank you. I guess another question is related to defund the police. Could you tell us, Chief Armstrong, could you tell us the challenges that you and your colleagues have encountered during this whole movement?
Yeah, probably one of the biggest challenges I've dealt with over the last 2 years is this defund the police sort of idea. And I really believe that it's rooted in people wanting to see better policing, more quality professional policing. And I think people believe that that can occur. And so they believe that there should be potentially an alternative to police. Now, for me, I just, in the city of Oakland, and I want to be correct when I say not necessarily defunded, funds were reallocated from the department for an alternative response. And it's challenging because, my overall responsibility is public safety for the entire city of Oakland. And the idea for me was, does the reallocation of funds from the police department to another program, is that going to lead to a safer city? And that was the question that was left unanswered. To just satisfy philosophical beliefs that I want to see something other than policing, when you have an enormous violence problem, it just didn't seem to actually make very much sense. Now, I'm completely open to alternative responses to police, but I didn't think it needed to be at the expense of resources within the police department. Not in a city where over the last 2 years we've seen 124 homicides and 134 homicides back-to-back years. Nightly we experience call counts that reach 250 standing calls, which essentially means there's nobody to respond to those calls. They are waiting for hours, and in some cases even days. That to me suggests that there is a resource problem. We don't have the adequate number of officers to respond to the call volume that we're taking in Oakland. And so I thought, although I support the new program that we help fund, which is our macro program, which is a non-police response, an alternative response. I look forward to what they can do in the community. I think it's important that community play a role in public safety. No doubt about it, but I do think we have to have the question of, when I came into the police department over close to 25 years ago, the city of Oakland was about 365,000 people. Now the city is close to 450,000 people. When I came in, we had nearly 800 officers. Today we sit at 667. So while the city has almost grown 100,000 people, we have nearly 133 less officers. And the call volume is much higher. And I think when some people may not even understand the dynamic of, if you've ever called 911 from your car, from your cell phone, you've always been forwarded in most cases to the California Highway Patrol as the dispatch center. And then they would triage those calls and send them to the local jurisdiction. Well, Highway Patrol has begun to move all of those calls back to the original jurisdiction. What does that mean for Oakland? That means we took in, for this year, we'll take in an additional 350,000 calls. So we will reach 1 million calls this year, and we just don't have the resources to meet that demand. So we can have a conversation about improving policing, but I think those are two different conversations about what level of resources you need to deal with the challenges that you have in your particular city.
Thank you. I have two more questions now, then I'll open up to the floor. One for Jeff and one for Vern. So Jeff, you are now working at Urban Alchemy, which provide community support for the local community and people who live there and also the homeless persons. So what are some of the top challenges? Briefly telling us.
Some of the top
challenges
of doing that work? Well, I think the top challenge is, well, I should just also say, Urban Alchemy, most of our staff have been incarcerated. Most of them were LTOs or long-term offenders. We provide a variety of services, street cleaning, bathrooms and showers for unsheltered folks. We run shelters. We provide community ambassador services in LA. We run the Circle program. We respond when a 911 call comes in about a homeless person in certain neighborhoods where we respond. But we don't like to, even though I may have said it once, and my apologies, Chief, we don't like to say alternatives to the police. We like to say complementary strategies to policing, because we don't think that, because we don't want to give the impression that we don't support the police and that we don't think that the policing is incredibly important, like Tom and the Chief were talking about. So we're a complementary strategy to policing. That's most of what we do. Honestly, the biggest challenge I could think of is in the past 4 months, 2 of my colleagues were shot by drug dealers. On the streets, we don't, because we're not out there to force people to do anything. We're not out there to tell drug dealers to go away. It's not our job. We're not there to, we're just there to engage with people and get them to, to get them to not engage in antisocial behavior. But unfortunately, that seemed like it was a threat. And I'll just say, it was both, in both cases, or it was, no, that's not true. Only one case was a Honduran drug dealer, because they're kind of running the streets of the Tenderloin. The other situation was a little bit different, but both were involved drugs. So it's really, but man, bless my coworkers. I feel so honored to be there. I mean, they did not miss a beat. Nobody. Everybody was back to work the next day. Thank goodness both of my colleagues were fine. It wasn't serious because these women and men are so committed to making the conditions in what was their, in many cases, their neighborhoods better. And because they've been through some pretty hard times, they just were able to roll with it. And they all would joke with me and be like, "Don't worry, it's okay to still wear your shirt, Jeff. We'll keep an eye on you," because a lot of them feel like the Urban Alchemy logo is like a target. So that's a huge challenge. But I'd say more germane to this conversation, I'd say the biggest challenge is, we don't have enough access to services for our clients. Tom and I were just lamenting, like trying to get somebody in a treatment in San Francisco, even if they want it, it's like, I can't figure it out. It's just so complicated. So if we have somebody who wants to go to treatment, we would just hold their hand and take them to treatment and come back and check on them every day to see how it's going. But we have to take them to another place where they get screened and they may or may not get treatment then, and they may have to go back the next day and then they got to go somewhere. It's crazy. So the lack of access to services makes it hard because a lot of people see us as like, we're telling them to not be in the doorway and we're trying to offer assistance, but we can't always offer what they need. And just one more thing, and I'll shut up. But like my staff, we pay our folks well. We refuse to pay less than a living wage with benefits to all of our employees, but they don't make a ton of money. So because they don't have stuff to give, they often just go into their own pockets and like buy food. Or buy coffee, or take somebody to they can't get them the treatment, so they'll take them, to the Burger King on the corner there and get them a meal. But that's kind of heartbreaking to not have that. So I'd say getting shot at and not having enough services are our two biggest challenges.
Thank you. My last question is for Vern. So can you talk a little bit about drug court? Is it effective, and why are we not using them now?
Well, the consequence of the stuff that I was talking about before with realignment and Prop 47 is that, and it was talked about earlier today in one of the earlier panels, is that there has to be some type of an incentive for those types of a drug court to work. There has to be a consequence and an incentive, and it can't be. As somebody said earlier, that maybe a year from now or 2 years from now there might be a consequence. It needs to be right now. There's a consequence. Drug courts, to the extent that they were working and beginning to be effective, I believe in California 8 to 10 years ago, they were judges like Larry Brown in Sacramento, and there's one in Santa Clara, dealing with behavioral health as well as drug courts. Those types of things work because they had judges who would impose a sanction. If they said they're going to do something, if they said, if you don't do this, if you get a positive test, you're going in for 7 days, and they actually meant it, and they followed up on it. Those types of things would work. What we have now is and I'm not blaming any lawyers that might be here, the public defenders, the attorneys that represent them tell the individual, there's no consequence if you just say, I don't want to do it. Nothing will happen. And guess what? Nothing happens. And so why would you do it? Why do you do it? And that's kind of the trade-off with it. It wasn't drug courts were not perfect. I think there was a lot of room for improvement. But it's like that in everything. I'm sitting up here and you're asking about the Defund the Police, the Housing First, all of these things. I hate slogans. When slogans like that, they try to make it so people oversimplify something so they can get behind it, and they oftentimes don't understand what it is that they're actually advocating. I had a legislator try to tell me that when he was talking about defund the police, he didn't mean to actually get rid of the police and defund them. What he meant was that we needed to have more professional law enforcement. And I said, well, here's the problem with that. And it's like with all these slogans. If you demonize law enforcement, and then like the chief, I don't know if you have kids, but if you've been in law enforcement, if you've been in this business for 25 or 30 years, and you have a son or daughter who has options, and they say to you, you know what, I think I want to go in law enforcement. I think I want to be a highway patrol officer. I want to be a police officer in Oakland. I won't speak for you, but I suspect that's going to be a really serious conversation about maybe you want to think about those options. And so what ends up happening with that is that we're losing really qualified, motivated people who are no longer coming into law enforcement now because of this type of demonization of them, and that they'll say, I'm going to do something different. Yeah. And that's happened. It's making recruiting much tougher. It's making officers have to work overtime. And what we're getting, instead of getting more professional officers, we're getting overstressed officers that can't respond to stuff. Look at this thing, the media attention in San Francisco over the officers that responded to a pot house, a dispensary. And that they pulled up outside and they sat up the road and they didn't immediately go into that. I don't know if you've seen that. There's been quite a bit of media in San Francisco. Why didn't they immediately, the first officers on scene, why didn't they go in and stop that burglary? That's what they're asking. I know why they didn't do it, and it's the era of what we're living in right now, the consequences. They don't know if the person's armed inside. They haven't had a supervisor tell them to specifically go in. They know anything they do is going to be judged and second-guessed. And it is a very tough thing for law enforcement now.
Thank you so much. So now I'll open up to the floor. Any questions from the audience? David, right there, David.
Yeah, that's a very good question. I've advocated for just repealing Prop 47 in total and starting over. I testified in front of the legislature on that, and the response from a legislator was, so you're in favor of mass incarceration? And I said, because you don't have real policy discussions at the legislature, for any of you who have not been there recently. That is not what happens there. But I spoke with him separately, and I said, you do understand that Prop 47 is not mass incarceration. These are low-level felons that people that don't typically go to prison. They're in and out of jail and spending time in jail. That's the net. What your response has nothing to do with what it is that I'm talking about. The way to fix it, what we need to do, I support what the governor is advocating with the care courts. I think the devil is in the details, to use that expression. People should not go to jail or prison because they have a drug problem. They should not go to jail in and of itself. They should not go to jail or prison, certainly because they're mentally ill and they're schizophrenics, that they've decided not to take their medication. I don't want them. I saw it. It bothered me from my career seeing this thing of what I call the life on the installment plan, where you see it's like, this person is in and out of custody because they're committing low-level offenses because we let them. And so I don't know what the perfect solution is, starting with Prop 47. That video that you played, I'll leave you with this, and I'll shut up. That video you could watch. The district attorney of Yolo County, who's a very good friend of mine, his nephew, that is like watching him. He is an affluent kid, grew up a very well-educated family, had every opportunity for him. He lives in West Sac. He laughs at law enforcement when he's been arrested multiple times. I don't know how many, but it's a big number, a number of times. He's like, I get sex when I want sex. I get drugs when I want stuff. I don't need or want anything. You guys have told us there is no consequence for anything that I do and the lifestyle that I've chosen to live. That is the problem. And repealing Prop 47 is a big part of that.
Thank you. Any other questions? Lisa?
Sorry, Lisa, be right there.
And if others have questions, you could stand up so I can see you.
Yeah, I have a question about criminalization, and by which I mean, over time, we've gotten to the point as a society where law enforcement has the primary responsibility for dealing with mental health calls and dealing with mental health as like frontline first responders. My question is, how do we push it back away out of law enforcement's court and put it back in the lap of our medical providers and our social services? How do police officers who are not really in a position to say no to a call And how do we as policymakers kind of try to undo that damage?
Well, I think what we're doing in Oakland is partnered with the Alameda County Mental Health Department, really relying on the psychologist to partner with the department, be actually in the car with the officer, right? So we have a program where an officer and a clinician are partnered together, and they're responding to calls together and allowing the clinician to actually evaluate the person, be able to provide them the support that they need. I think the delicate balance, though, I've seen is that the reality is that people don't call 911 on family members or loved ones unless there's violence. And so I think that the misnomer is that people sometimes think the mere fact that law enforcement responds to mental health calls is, not the right response. But I would say, as we've looked at our overall calls with the new program that we've implemented in Oakland, 90% of those calls we would still have to go to because there's some violence related to that call. I often say a mother doesn't call the police on her child unless she has lost complete control of him, or he or she, and you need law enforcement to intervene to make sure that they get the services that they need. And so I don't expect that our call volume, particularly when it comes to mental health calls, will go down very much with an alternative response, because in most cases, if the person was willing to voluntarily be evaluated or go with an ambulance, you actually don't need police, right? You can simply call an ambulance and they can transport that person and get them the support that they need. So I do think, again, it's to what he just spoke of, right? It's like everybody has used these words that they believe, have meaning when you say, oh, let's have, law enforcement not respond to mental health calls, right? That, believe me, every police officer in America would love to not go to a mental health call, right? I do believe that law enforcement has been asked to do too many things over many years, things that we probably shouldn't be doing, probably weren't well trained to do. And so I do think these alternative responses allow us to actually dial back, to your point, the things that we probably don't need to do, other systems that are better equipped to do that, better response, and I think in some ways provide the person actually a better outcome than if we were to come, right? And so we are trying to sort of deal with that issue around what is the right approach. Is it the approach where law enforcement and clinicians are coming together, or is it an approach without law enforcement at all?
Thank you. Let's take one last question.
Not so much a question as complicating the narrative of what you just raised, Chief. Of course, many of the calls that come in now to police officers, to 911, are for things that involve violence because of the responses from police who are to respond to violence. So if there were an complementary alternative, I think the idea is that there'd be some preventative calls. So there would be someone to step in earlier and hopefully reduce some of the calls you get in the end. Maybe it wouldn't change the call volume. Maybe it would just get other people care earlier. But I want to name that as we're thinking about what complementary services mean, because there's more to the reasons people call police at this point. I guess what I want to say is it's a bit of a chicken-egg problem. If there were different services coming when people called 911, they might not all be violence calls. How does that sit with you? Does that seem right?
No,
Yeah,
I'm fine with that. One of the things I think is going to be a dramatic shift in Oakland is that our macro program will have its own number. And so less reliance on the 911 system might help. And so I totally agree with you. I think once communities like Oakland can be introduced to a new system that might be able to send alternative services, I think that might have an impact on our overall call volume, particularly even mental health calls, because they will be able to provide additional resources that law enforcement is not equipped to provide. And so we'll see, but we are eagerly anticipating a full citywide deployment of this program to evaluate it. So from the Oakland Police Department standpoint, we look forward to working with them. It will definitely help us be more responsive to our community.
Appreciate that. I wanted to simply underscore that in the spirit of the slogan comment, that there are some of the ways that we speak about these opportunities and these different strategies that can really turn people off and limit our thinking about what possibilities are available. So thanks for responding to that.
I see Vern had.
Just the last two questions. It's the point of what you said is if you can move back the timeline a little bit, because as the chief was saying is when law enforcement gets called, things are really bad. You're calling on a family member, things are really bad. If we can move back the time, and you made the point earlier today, is the statutes that we currently have put the law enforcement when they come out, is this person 5150? Are they such a danger to themselves or others that I have to do something right now? That is a mistake. We need to intervene before the person is decompensated to that point. And if we could do that, then we have fewer calls and fewer of those types of things to deal with. And that it requires a change in the statutes.
All right, thank you. Please join me in thanking this great panel. Thank you.
Thanks, Xiaolu, for expertly moderating the session unexpectedly, too. Just want to tell everyone what the game plan is here. They're going to flip the room, so we have a reception outside. There is beer and wine, but for my undergrad students who are in here, Patricio, Victoria, no. Cranberry juice, apple juice, water. In any case, we'll come, there you are. Yeah, that's right. We'll be able to come back in at 6:30 for the dinner and the keynote dinner address by Mayor Kevin Falconer with Olivia Martin, who's a student here. Great, so we'll see you out there.